Hey yo, it's Monday. Was finally able to go to the doctor this morning, like we've been talking about. It's day 74, if I'm not wrong. So tomorrow should be day 75. That's pretty cool. We've got a good baseline now. Clearly, there's a lot of things we need to lock in with, namely, especially nutrition. I think we've got everything else covered. So we got to start implementing the stretches that they gave us. And I need to figure out a better shoe solution for my feet. I'm getting some MRI scans done on them. There could be a possible issue there where we have yet to see. But yeah, good things to work on. Trying to get in there. We got back day today. So I might have said chest day in the beginning, my bad. But we got back day today, and we're going to be doing a lot of lat pull downs and some finishing up with some rows. Yeah, that's it. Got to get in and get out. I got some other stuff today, so yep. I'll see y'all at the gym.
Okay, cool. Alright, so in terms of the upper neck pain area, kind of the shoulder neck area, whatever you like to call it, I do think your traps are playing a big role in it, but also so are your cervical muscles. So your spine, right, is your spinal cord, and then you have the bones behind it called your vertebrae. Those are the things you can push on. Off to the sides of those, you have different columns of muscles, and in the neck you have even more muscles that obviously help you hold your neck up, turn it sideways, bend it, etc. In your case, right, we see a few different things that I think are risk factors for the type of pain you're having. So your traps are generally pretty tight, and you tend to, like most of my power lifters, tend to be a little bit more rounded forward into your shoulders.
Right.
So we're seeing tight pecs, kind of some tight rotators across the shoulder.
Okay.
And so what I'm seeing is a lot of kind of muscular irritation and pulling onto different parts of the neck. And so where you're having a lot of that discomfort, that's kind of your suboccipital area.
Okay.
And that's a very common area for different neck muscles, trap muscles, etc., to cause a lot of irritation into there.
Okay.
And so a few things that I think will be beneficial is, the rolling that you're doing, also actually getting up into here. The most concerning, or kind of the areas you want to avoid, are the sides of the neck where the arteries and things are.
Okay.
But you can get into that neck muscle with the roller or with your finger fine.
Yeah.
And so that's the spot that I was kind of starting to push on, that you felt a little bit of that kind of zinging sensation. And so that's normal. That's a big trigger point or knot in that area. So just like any other knot that you get right when you lift, if you take, if you sleep funny, whatever, right?
Yeah.
You can rub those out, you can massage those. And that'll help the knot in that moment in time. But then to kind of help it stay better, really working on a couple different stretches. So I'll give you a printout with a couple, and I'll emphasize the ones that I want you to do.
Okay.
It's a lot of cervical motion, but then especially retraction, so pushing the head backwards into your seat.
Gotcha.
Which, especially sitting at a desk, right, we all tend to do this a little bit, especially as the day goes on. So in terms of posture-wise, right, the 90-90, how your desk height is, seems pretty appropriate.
Okay.
But then just making sure that, like, every so often you're thinking of kind of drive the back of your head into the headrest of your chair, which will over time kind of elongate and let those muscles kind of start to stretch out.
Okay.
So I'll give you that. I'll give you a paper with that stretch on it and a couple other stretches that will help this general area loosen up, which will, I think, over time help you feel less of those symptoms.
Okay.
I'm not so worried about anything I'm seeing today in terms of nerve stuff down the arms, things like that. So I think you're okay without additional work at this point in time, as far as that area goes. Questions about that stuff?
No, although I would like, if there's a recommendation for a massage therapist that I could.
I don't have any in my network, but I know different insurance plans sometimes have massage therapists in network nowadays for a lot of plans. So that's something that certainly you could start with checking into that, or I bet if you ask around at your gym, you probably
I just don't want to go to the wrong person.
That's fair. For something like this, as long as they're not like cracking your neck around and moving it, and it's more just kind of soft tissue, deep tissue work, that should be fine.
Okay, cool.
But also, you may be surprised when you start to just do a little bit more onto this area at home, now that you know it's safe. You may also just start to feel better.
Okay.
Other questions about that area?
No, sir.
Okay. The right ankle, kind of that back of the ankle, Achilles area that you're having some discomfort in. I agree with you, it is your Achilles that seems to be the most bothersome. I think it's because, generally speaking, both your Achilles are tight. Your right is tighter than your left today when I'm testing it. And so the reason that matters is just as you plantar flex and dorsiflex, that Achilles can sometimes kind of have to move through a bigger range of motion.
Okay.
So in addition to the strength work, right, you got a lot of good strength across your feet and ankles, but we got to make sure that you're also mobilizing them effectively.
Mm-hmm.
So I'm going to give you a couple stretches that you can do different variants of depending on kind of what you have access to either at home or at the gym, just kind of that fits your schedule in life the easiest.
Yeah.
And the goal is to stretch both your gastroc and your soleus. So your soleus, right, is your deeper muscle. It kind of does more of that chronic endurance stuff with your calf.
Mm-hmm.
The gastroc is, the one that you can see, the one that you have, big calf muscles. That's the gastroc.
Okay.
And so that's the one that gives you a lot more of that like burst power explosion.
Okay.
So making sure that we're stretching both of those because both of those are pretty tight in your right side, especially compared to your left, but generally in both.
Okay.
The left foot, I would like to do a little bit more testing on. What you're describing is pretty consistent with what we call a Morton's neuroma, which is a specific type of lesion in between kind of the toe pads.
Okay.
And so in that web space that you're having all of those symptoms in and pretty reproducible to the touch, that's where we would typically find one, and that's one of the most common locations is actually in that specific web space.
Okay.
Depending on if we see one or not, how big it is, what your symptoms do, there are lots of ways that we can talk about managing it.
Okay.
But the first step for me would be to confirm it and then also find you supportive shoe wear. So a lot of people who, if they do have one, tend to find very rigid shoes more uncomfortable because you just kind of push harder into it.
Yeah.
And then also barefoot can sometimes be more uncomfortable because of that same, especially if you have like hardwood floors or hard tiling, etc. All of that can be a little more uncomfortable. So I'd recommend in the meantime, considering at least like a pair of thick house slippers or socks, something like that, if that's bothering you at home.
Okay.
And then as far as your Jordans and stuff goes, if you like your Jordans, that's fine. Maybe we want to consider like an over-the-counter shoe insert, just something like a Superfeet from Dick's or any of those kinds of basic ones just to start with.
Okay.
We may do something more advanced than that. We may, go in a completely different direction.
Yeah.
But the next step for me right now would be to then get an MRI and just take a look and see, do we see one? What does it look like? How big is it? What else is going on in that region?
Okay.
Regarding blood work, that's not typically something that I test out of my practice without kind of a medical, reason that I'm testing for. And at least right now, I'm not seeing something to me that tells me that there's a other kind of systemic thing that I'm looking for to address.
Okay.
Certainly, I know like a lot of LabCorp and things like that nowadays let you test yourself.
Okay.
And so if that's the case, you would certainly be welcome to do that and then kind of see what you find if you get any abnormal results and kind of research it through there. But typically, I don't typically order them unless I have like a medical thing I'm investigating. Questions about A, B, or C?
No. I think you covered everything.
Let me go grab that MRI order for you. So what I'm going to do is I'm going to order the test. I'll print out the copy of the order for you. In this area, I tend to use for my adult patients community radiology. I use pretty frequently. They tend to get good sequences of images, and they tend to do a good job of kind of doing all the reporting and stuff on the back end as well that I find beneficial.
Okay.
So let me get you that order.
All right.
Let me grab and highlight kind of the specific stretches that I'd like for you to do in your shoulder neck region and then also in that right ankle especially.
Okay.
And we'll get you out of here.
Yeah, that's good.
All right. Very nice to meet you, Rod. Give us a couple minutes. We'll get you on your way.
Sounds good. All right. So, as you guys saw, that was a doctor's appointment visit. That was a summary after we went through all the stretches and whatnot. So I got some stretches to do. I'll be doing them over the next couple weeks to continue to rehab the neck and work on developing the muscle in order to make sure that I do not get that sort of injury down the line or make it worse. I went for a 3-mile run in the morning before the doctor's appointment. That was what you guys saw earlier with Nala. And then in the evening was back day. So started with some pull-ups. I did, I think, 4 to 5 sets of those. The first set was not assisted. The second to last set, or the second to fifth set, were all assisted pull-ups. I wanted to work on muscle activation, considering I've just started doing pull-ups again after a couple weeks since the neck injury. So that felt pretty good. Then we moved into cable pull downs. overhead cable pull downs. I think I don't. That might be the name for it, but these move pretty well. All in all, this was a good warm up before I moved into the pull downs. Like I said in the beginning, I wanted to focus a lot on the pull down movement since I haven't been able to over the last 2 weeks, and they moved pretty well. There was some like I think muscle act. I didn't actually realize that until I got to the gym that I had forgotten my pre-workout at home. So I didn't, I guess the drive just wasn't, or the focus, the muscle activation wasn't there like it usually is, which is kind of annoying, but it's okay, it happens. I was able to still get through my workout and I was able to do a fair bit, or put a fair bit of effort uh, into the workout. If I'm being honest, um, these last few days, last week or so, my mood's been less than stellar. And I think it's taken an effect in terms of it's a few different things, right? We have the weight gain, and we have the lack of being able to train as much as I would want to in certain areas of my body parts, specifically shoulders and then upper back. But we've been able to do that now, which is good. Um, the anxiety of having a possibly worse injury than what I thought it was weighing on my head for the last uh 2 weeks, so knowing that that's not an issue is good. Although we might, there's still stuff to go on into with the shoes and my feet, specifically my left foot. As you guys saw in the video for my doctor's visit, we need to get an MRI for my left foot, and we'll see what that entails when that happens. But for the time being, training can resume its natural cadence. I think we're going to be doing. I know I said we're going to be doing running every day, 5 days a week, and then training on top, or lifting weights on top of that. With considering how my feet have been over the last 2 days, like after the 10K on Saturday, I was barely able to walk around. If I'm being honest, my feet just were aching and really sore. I don't know if it's because I'm getting back into running after not having ran consistently for a while, but it's certainly something I have to take into consideration. Maybe going every day right off the bat is not the best idea, but we'll see. I was hoping to go for a run this morning, but woke up a little late, and it's okay. So, mind you, this is the next day. I missed uploading the video or the vlog for last night, so I'm gonna be uploading this a little late, and that's okay. It happens. But yeah, so I think we're gonna be alternating between going for a run every day, between running and doing Stairmaster. I think I'm gonna maintain that even on my recovery days. I'm still gonna go for a run, and we'll maintain the cadence for lifting weights from Friday to Tuesday. Friday, Saturday, Sunday, Monday, Tuesday. Yeah, Friday's out of the week. But we're gonna alternate between Stairmaster and running outside for cardio purposes. Honestly, cardio is feeling pretty good. Even like yesterday's run outside felt pretty good. Also, I felt heavy, and that makes sense. I've gained 5 pounds since I started this a few months ago. So, and that's okay. I'm not. It does. I guess it does weigh on me a little bit. And I called it a cut for that long, and yet I've gained weight. Of course, I've added muscle mass, but at the same time, I've clearly added a little bit of fat, and I want to work that down. So I need to be a little more real with myself, a little more honest with myself about what my nutrition looks like, and what I need to do in order to bring it back down to a reasonable weight, so that it's not affecting my cardio. Because I feel like I could run more, if not better, with better form if it weren't for the weight. Having that much weight in my legs and in my upper body, it's not meant for like running long period distances or long periods of time. So that's something to take into consideration over the next few weeks while I'm refining um, what my training looks like, while I transition from what I would consider like bodybuilding towards more of I don't even know if I would consider a hybrid athlete type of situation, but it is what it is. Tomato, tomato. As far as I'm concerned right now, it's just cardio on top of um, lifting weights. So it's not exactly super crazy. Uh, yeah, all in all, a pretty decent back workout. I think a lot of people don't really talk about how uh, like doing this day in and out and then trying to find the motivation to do it day in and out. Like it's easy. It's for me, it's easy to go in, but to maintain that same effort, that same sort of energy, day in and day out, it creeps up on you. Like doing the vlogs every day and being showing up for myself, and showing myself that I can do it every day. It's like it's easy to say, and it's always easy to say like, yeah, nutrition and cardio and weights and getting the good recovery in. It's all really, really easy to say. But like when push comes to shove, and like then the temptation is there to not do it, or you're tired or depressed or whatever else, it stacks up. And I think we don't give ourselves enough. I think the fitness community tends to get a little toxic with that from time to time. So being a little mindful of that and just understanding where we are and telling ourselves it's okay that you're not feeling the best. It's okay to not be okay, and just like understand that emotion and experience the emotion rather than trying to push it away and ignore it. That helps a little more. Of course, it takes time to get past issues like these. Life ebbs and flows, and learning to ride those waves is a that in and of itself takes a lifetime, right? So, with all that being said, I'm happy that I get to do this every day, and I am more than thankful that I can afford to do these things and afford the food that I can eat and all these going to the gym and being able to run and do all these things. It's a very it's not a necessity, right? We should never take it for granted. So with that in mind, yeah, another good day in the books. For today, we got arms and abs and cardio. I'm gonna do Stairmaster, but we'll talk more about that on today's vlog. Thank you everyone for who does listen to this. I appreciate it. On that note, I'll see you all tomorrow, or well, today.